The masks are back this Friday, regardless of vaccination status. Chicago has once again implemented an indoor mask requirement for places like restaurants, bars, and gyms. This as the Biden administration announces a COVID booster shot will be available for Americans starting in September, with nursing home residents, healthcare workers, and emergency workers at the front of the line.
This will boost your immune response. It will increase your protection from COVID-19. And it's the best way to protect ourselves from new variants that could arise.
And joining us to talk about all that and more is Dr. Robert Murphy, Director of the Institute for Global Health at Northwestern University's Feinberg School of Medicine. Dr. Murphy, always great to have you. So starting Friday, masks are back indoors as the city is seeing about 400 cases per day or more. Can a mask mandate work to halt the spread if you don't also have social distancing or shutdowns?
Yeah, the masks indisputably work. Social distancing works. It all works. The vaccine works, and you put them all together and you can control this pandemic. We've done it multiple times.
And given that, I mean, I'm hearing anecdotally about a breakthrough case among people that I know almost every single day. So what does the data say about the rate of breakthrough among those who are vaccinated?
Well, the problem is the breakthrough rate is going up. And it was quite clear from the discussion this morning with Dr. Fauci, Dr. Walensky from the CDC, Dr. Murthy, Surgeon General, the protection from the vaccine starts to go down somewhere after 6 months. And at 8 months, it's clear that the vaccine is not working as well. Hence, what the recommendation that you just played, they're going to start allowing people who've been vaccinated 8 or more months ago to get the booster shot.
And that, as we mentioned, starts September 20th. So what does the data say so far about the potential effectiveness as a booster shot?
Well, we know that the booster shot significantly increases the immune response to the virus. So based on these markers, it should work very well.
Does that mean, though, that 6 to 8 months from getting the booster shot, folks might need to get another booster shot as these vaccines tend to level off over that period of time, as you're mentioning?
Yeah, no, it's going to be 8 months. We have booster shots for the flu, although that's seasonal, at 1 year. Pneumovax, is every 5 years. I mean, you have different time periods, but it's looking like with coronavirus that it's 8 months and you need another shot.
So people already lining up to get that third shot, although we still have children under 12 that have not been vaccinated. What does the data say about when they might be able to be vaccinated, especially as classes are resuming as we speak?
Well, the whole thing is being driven by the unvaccinated. So they have the adults that don't want to take the vaccine. They're spreading it. And if you look at that group, they're in a lot of trouble. That's who's really in the hospital today. There's very few vaccinated people. I mean, there's a few, but not too many. The school kids are also going to be spreading it. Now, but that's going to end pretty soon because age 4 to 11 is likely to get approval sometime in the very near future. And so then those kids that are in school can be vaccinated. And by the end of the year, there may be approval down to 6 months of age. So then basically almost the entire population can be protected, except for the people that will not take the vaccine.
Yeah, and you mentioned that with hospitalizations, that's one of the metrics locally that is not quite as concerning. They don't seem to be going up as fast as cases are going up, as opposed to what we're seeing in Texas, Florida, and throughout much of the Southeast, where a lot of those states are facing crisis situations with their hospitals. Is that just because of the rate of vaccination? There are fewer people vaccinated there, and so they're getting sicker?
I think what you're seeing is the beginning of herd immunity. You can still get infected, but you don't get severe disease, you don't end up in the hospital, and you don't die. These vaccines work. If you need a booster at 8 months, so what? Just go get the booster. You already had, you may be super protected at that time. It's really going to be interesting to see what happens when those boosters come out. But if you're not vaccinated, and that's these states that have the low vaccine rates, their healthcare systems are imploding. They have tents outside of the hospitals in Houston and elsewhere. ICU beds are almost non-existent in many of these places. This is what happens if the population doesn't get vaccinated.
And in a lot of those states, you see leadership and governors, banning mask mandates and things like that, which clearly probably exacerbates the spread. You saw Chicago officials here say Lollapalooza was not a super spreader event, even though it was almost universally worried that it could be. Is that what the data is showing you, that truly there wasn't a massive bump from hundreds of thousands of people being out in Grant Park together?
Almost 400,000 people. Granted, they were outside, they were younger. The reporting is not perfect, but hey, those people are not ending up in the hospital. They're not dying. And we should have seen big increases in the number of reported cases, the percent positive, and the number of people in the hospital already. And we're not seeing it. I think, they did a very smart thing at Lola. At the beginning, when they first were marketing the tickets, everybody had to be vaccinated. So they selected people who were willing to be vaccinated or get tested just before they come, and supposedly only 12% fit that category. Okay, granted, some people said they walked in without showing their
some
card.
Some margin for error there, probably.
Yeah, I mean, there's going to be some error. But hey, let's face it, the hospitals aren't full of those people.
So another sign of what you're saying is a potential herd immunity developing here in Chicago and in Illinois.
Right, exactly. And the states that have vaccination rates as good as ours.
And given that, Governor Pritzker said the other day that, we're going to live with COVID for a long time coming, especially given what we're seeing in some of the South and Southeastern states. Does that mean new variants that could be vaccine resistant? And what kind of time frame are we looking at? Months, years?
Well, until you control this pandemic, you're going to have new variants. We already have Delta Plus. And we're going to have Delta Plus Plus. Then they're going to have yet another variant. They're going to give another Greek letter. And maybe the next one is not going to be as good, the vaccines aren't going to be as good against. That's the risk. That's why we have to get these infection rates down. That'll slow the development of the variants.
And, metrics said that officials look on as positive. More people are getting vaccinated over the last several weeks, perhaps as a response to the rising amount of cases. All right, Dr. Murphy, you're always so succinct and clear with us on this. Thank you, as always, for being here.
Thanks for having me.